So Collins, tell me about the difference between mentoring for you versus consulting.
Some of my doctors want to just do mentoring from the beginning because they know they're going to want support and help throughout, and that's great. Some doctors, aren't sure if they're going to want mentoring from the beginning. They want the consulting, and so they send a case in for consulting, and if the patient decides to accept treatment and move forward with the case, then they'll upgrade the case to mentoring so that they have support along the way. And other doctors will wait until possibly they run into a problem or have an additional need for help or need some revisions, and then they can upgrade to mentoring. And some do fine to stick with the consulting, and the case works fine and everything goes fine, and they don't end up needing the mentoring. I enjoy mentoring. I enjoy being there to support, to see the progress photos, to see how it's going, to encourage them that it's going well, to be able to answer questions, give guidance, give tips, help them with revisions and refinements. And it's just satisfying for me to be able to see the case progress and how it turned out and the end results. And so I enjoy the mentoring process. Those doctors who choose to do that with me, it's fun. It's rewarding.
So Don, you came out of retirement a few years ago, and one of the big passions you have now is for your consulting and mentoring clients. Tell me about what it means to you to have these students learning from you.
I'm sort of their coach, their director. I give them directions. Could they have done that themselves? Maybe, but I lay it out for them with the nearly 50 years of experience that I've had, hundreds of thousands of cases, I'm sure, and adding that input there, I feel like I'm going to make the case go smoother. They're going to be more confident in that it's going to come out nicely. And I live for the end results, although I can already see them. It's very visual. I can see the end result, but there is a wonderful feeling when you get to see a successful finish.
A bad case and a bad result is it hurts. And when we get hurt, we typically don't like getting hurt again. And so we lose confidence, our staff loses confidence. And the reason why we provide support and why we are focused on the GP is because we want them to be successful. We want them to do cases that are fun, that are rewarding emotionally, and they're rewarding financially, that are productive for them. The staff's happy, they're happy, the patient's happy. If we can help them have that experience, they're going to want to do more ortho. They're going to gain experience. They're going to be able to do more cases, more complex cases. And we can help them build their career, which is fun. That's why we do what we do. If we can help them avoid one of those situations that ends up being something that when they see it on the schedule, their heart drops a little bit and they get a little bit sick in their stomach, we want to help them avoid that and have success from the beginning and then build on that success to have a great career and doing orthodontics in their practice.